Thank you for coming out here today to Fire Station 3 for our exciting announcement here about the CARES team. Just want to give you a quick overview of what to expect this morning. We'll hear from Fire Chief Stephen Davis. We'll also hear from Louie, the Director of the Dane County Public Safety Communication 911 Center. We'll also hear from Alder Arvina Martin from District 11 and City of Madison Mayor Satya Rhodes Conway. So with that, I turn it over to, and then we'll have a Q&A after that, so stick around for that. And without further ado, I turn it over to Fire Chief Stephen Davis.
Thank you, Cynthia. Hello, everyone. I'm Steve Davis. I'm the Fire Chief here in the City of Madison, and excited to have you all here today. This has been a long, very personal and emotional project for everyone in the Madison Fire Department to get to the point where we're here today to announce our new CARES team, our Community Alternative Response to Emergency Situations and Services team. We're super excited. And like I said, this is a very personal day for me. As a former paramedic in the City of Madison, there was always calls that as a paramedic that we went on for mental and behavioral health type emergencies that fell outside of our protocols. And we really, throughout the years, have not had another place or an alternate resources to deal with people that are having some type of behavioral, emotional, or mental health crisis. And today, we start that journey. The team will officially go into service on September 1st. The team is made up of 2 paramedics, and the paramedics' job on calls like these that we'll describe as the day goes on is to rule out any medical emergency that might be occurring. There's times in people's lives where they may have an underlying medical issue a patient may have that manifests as some type of behavioral mental health problem. And as it turns out, like if it's a diabetic issue or some other underlying medical issue, sometimes if we fix that, the behavioral health component comes into play and fixes itself as well. So 2 paramedics and 2 crisis workers that we've partnered with Journey Mental Health in Dane County to provide support. Like I said, this is an alternative response. We've got a lot of speakers today that are going to talk about what that means and where we're going to go with this team. And one of those folks will follow me is Louie at the 911 Center, the director of the 911 Center. They play an integral role in this team as they have protocols and questioning that they can follow that identifies this team as the appropriate resource to send in lieu of the police department or the paramedic service in the fire department. And so, without further ado, I'll turn the mic over to Louie and we'll be available to answer questions at the end. Louie.
Thank you, Chief Davis. I'm Louie Bixler, Director of the Dane County Public Safety Communication Center, the 911 Center. And I just can't say enough about how excited we are to be part of this really incredible initiative that reimagines the resources that we within the Public Safety Communication Center have to help at our disposal for those that call for assistance, particularly those that are in need of high-level crisis intervention. The ability to connect people with the right resources begins within the communication center, and having this resource truly allows us to offer a more appropriate response to very specific needs. Following models that have been successful in other cities like Denver, Austin, Eugene, San Francisco, we've been able to help and create a program that will help Madison have the right response for the right type of call. And the program isn't about sending social workers and community paramedics to police calls. It's about sending a team of trained professionals to calls that are better addressed outside of the criminal justice scope. Connecting our callers with the correct resource is vital in helping people heal and also in freeing up police and 911 resources to positively impact resources and response times for other emergencies. A big, exciting part of this initiative as well is the data collection initiatives between the 911 Center and the City of Madison. using evidence-based practices. We'll be able to use that to help the CARES team evolve and grow as necessary with that with those particular pieces of data. The talented professionals at the Communications Center dedicate themselves through their selflessness and commitment to help those in need every day. And this is a resource that's going to help us evolve that assistance to make the greatest impact for the community. Okay, now Alder Martin.
Oh, hi, everybody. I am Alder Arvina Martin, and I represent Madison's 11th Aldermanic District on the west side of town. When I was first elected in 2017, I was the only new alder elected at the time, so I did all of my orientations kind of one-on-one. My fire department orientation ended up turning into more of a conversation between me and Chief Davis, and I was really excited when he told me about this idea back then, and thinking about how it could work and how we could get this done. And I'm even more thankful for his call last year when he said, "I think it's time. I think we can do this now." And I said, I agree, and we got to work. The work that city staff and other engaged stakeholders have done and put into this project is incredible. We have had people not only from the fire department and the police department involved, but also the mental health community, the hospitals in the city of Madison, and other folks that may have to deal with or make calls under a program like this, like perhaps the public library. So we had a lot of people be able to contribute ideas and look at the models that already existed to figure out how we could make this program best serve the people of Madison. And I am absolutely thrilled that we're going to be starting next week. This is also a very personal issue to me in that I have had a situation with a loved one dealing with a mental health crisis and not knowing if calling the police would make that person's situation better or worse, and ultimately calling and feeling not so great because I didn't know how it would be taken. I'm really glad to know that as of September 1st, we can start this and we can start having this program where we know that people can feel confident calling for help for their loved ones and knowing that they're going to get the support and the treatment that they may need. So I'm just unbelievably thankful for the work that everybody has done on this project, and I'm really excited to see how it works. So with that, Mayor Rhodes Conway.
Thank you, Alder Martin, and I want to thank everyone for being here today as we announce this implementation of a really important city innovation that will transform the way that we respond to residents who are experiencing behavioral or mental health challenges. Today we're launching this new emergency response team, which, as the chief said, is called the Madison Community Alternative Response Emergency Services, or Madison Cares. It's specifically designed for our residents who are undergoing mental health crisis. As the chief said, it pairs a community paramedic with a journey mental health crisis worker, and they will be charged with responding to nonviolent mental health emergencies in this van starting on September 1st. The initiative is run out of our fire department here at Station 3 with a program supervisor housed in Public Health Madison-Dane County. Madison Cares will treat mental health emergencies as the medical issues that they are, centering patient needs and patient care, and linking folks with the treatment options that they need. Madison Cares will send the right person to the right call. In many instances, sending someone in uniform could escalate rather than de-escalate the situation. And Madison Cares will reduce trauma for patients and reduce our reliance on emergency rooms and jails, which are sometimes the most costly and least appropriate option. This endeavor was included in my executive budget last year with support from the Common Council, and it grew out of our efforts to create alternatives to law enforcement for nonviolent emergency calls. But it is arriving at exactly the right time when for far too many folks, COVID has deepened anxiety and despair, leading to increased calls for service related to mental health needs. The CARES van will be out and about starting on September 1st, and if you need the CARES van, you are going to call 911. As you heard from the director, 911 will screen calls and decide on the most appropriate response for the emergency at hand. Prior to COVID, we estimated that the 911 center received about 7,000 mental health-related calls per year. The vast majority involving people in need of de-escalation and a helping hand. The Madison Cares initiative is designed to uniquely serve the needs of the Madison community through careful consideration of the available data and with the invaluable direction from those with lived experience and those working in the mental health field. For the first phase of this initiative, the teams will be active Monday through Friday, 11 a.m. to 7 p.m. in our central district. And the reason that we chose those hours and that geography is because the data tell us that that is where the greatest need is. Eventually, we may grow geographically as well as into other hours of the day. But that's going to be a data-driven decision, and I look forward to this year of innovation and learning to better inform the program and our needs as a community. I want to emphasize that CARES is designed to serve as an additional available resource for nonviolent behavioral health emergencies that occur in our community. We will still need our dedicated mental health officers and others at MPD who will partner with Journey Mental Health in the co-responder model, which works to resolve dangerous situations safely. And I want to thank Chief Barnes for being here to lend his support, and thank him for the help and expertise of Sergeant Sarah Simcoe, who leads the mental health unit, and Captain Matt Ty, who's also here with us, of Community Outreach, both of whom have backed this innovation from day one. In addition to the folks that you heard from today, I want to thank a long list of other people on the core team who have strategized about this for months, including Assistant Fire Chief for Medical Affairs, Chase Stedman, Mary Batare, Ruben Sinan, and Neve McPartland from my office, Ellie Anderson from the city's data team, and Dane County's mental health services team, including Todd Campbell, Carrie Simon, Hannah Whaley, and our friends at Journey Mental Health, including Hannah Flanagan, Sarah Hendrickson, and Tanya Letman-Shu. I want to welcome to the CARES team Paco Bonin, Mark Norton, Grace Falk, and Shaquila Galvez. This cross-government, cross-agency collaboration is a model that we can and must build on as we look to a future where we will need additional supports from the entire community, including a diversity of medical and mental health service providers, to create wraparound services that will ensure that our CARES van meets success. And I would be remiss if I did not thank Alder Arvina Martin, who planted the seed from that conversation with Chief Davis, from which this initiative has blossomed. And I also want to thank the entire Common Council that has consistently voted in support of funding for this initiative. And of course, finally, we have to honor those who in their time of need did not have this service. For them, I hope we can all be proud to make this lasting change today. Thank you again, all of you who are involved in this project, and congratulations on launching this van. Chief?
Thank you, Mayor Rhodes Conway. Appreciate the support in this, as well as Alder Martin and all the Common Council members and the Dane County Board, who has been very supportive, along with Executive Parisi. So I am going to act as the facilitator for questions. So if you have a question, we can ask. We're going to kind of take turns and keep some decorum. I'm going to need to repeat the question for our viewers that are online on the award-winning Madison channel. I'll start here.
Steve with Channel 27. I may have misheard it. You may have mentioned it. Where will the van be?
Yep, the van will be stationed right here at Station 3. As we started to build the team out in the beginning of January, and all of our partners worked together, one of our main partners was Madison Police Department, and Captain Matt Ty is here, but we really, as the mayor said, looked at a data-driven team, and we wanted to make sure that we put it in a location where the most use is needed at the time. And right now, the data shows the working hours that we've identified in the central part of the city are going to be the highest use points. And so it'll be stationed right here at Station 3. Yep.
I actually have a question directly.
Just wait, I had a question in the back.
Chief Davis, could you clarify why this additional resource is needed? I understand there's already a mental health unit with the police department. Is it more calls? Is it the fact these people won't be in uniform? What calls for this? What's the impetus?
Sure, and so there's a couple of things. One is that not all mental health, behavioral type emergencies include some form of violence. And so the folks that suffer from those conditions, they don't have guns, they don't have weapons, there's not domestic disputes involved. We know from surveying and from talking to those folks that they don't always want to see a police officer show up. And in the last 20 years or so, so much of the mental health crisis has been laid at the feet of the police department. And we know that through federal dollars, through state dollars. All those dollars go into the police department to handle mental health emergencies. And that's one of the issues from 2017 when Alder Martin and I talked. And simply put, these people are patients. And if they need to be in some type of medical system, they don't need to be in the law enforcement side in the law system. And so that was really and is the driving force behind this, is to offload a lot of the responsibility that Madison police have in these situations that they don't really, always know what to do either. They do the best they can, and they have Journey Mental Health supporting them. But these are medical emergencies. They're not law enforcement issues.
I have a question directly for Chief Marks, if that's all right.
Yeah, absolutely. Chief Barnes? Captain Ty?
Sure. Yep, both you guys. You heard Mayor Rhodes how we talked just about the sheer number of calls that are mental health related, and then obviously this emphasis of taking some of the pressure off police. What will it mean from a police department standpoint to know that you've got this resource and you're not sending just your officers to these calls every time? What will it mean from an MPD standpoint?
Well, my name is Sean Barnes, SHONBARNES, Chief of Police. I think it will be great for our police department because the key to effective policing is partnerships. And we see this as a significant partnership in our efforts to expand what we do and our efforts to professionalize some of the calls that we go on to make sure that those persons who are best suited for those calls are the person who does that. And if that's not the police, that's fine with us as long as the citizen gets the best treatment that they can.
You feel like this kind of opens up doors for you to focus on other things, maybe focus some attention elsewhere that before you go overwhelmed with all these calls coming in, you would not have been able to?
Well, certainly if responding to some of the nonviolent calls, we can certainly direct our resources toward other things that our community wants. But we'll certainly be there in the event someone calls 911 and they need us.
All right.
Call to direct, he's waiting for the 911 center.
Yep.
Is it a dispatcher that decides to launch the van? Is it someone working overnight, that makes that decision?
Yeah, we have Louie Bixler and Kevin Faso, the operations manager in the 911 center. The question is, who makes the call to send the C.A.R.E.S team versus the police department or the fire department? And I'll let you answer that.
All right, well, currently, we get these calls every day. So from a volume standpoint or even a protocol standpoint, there's not much difference for us. We're going to triage those calls as normal. What we have now is we have this additional resource. So if it meets specific criteria, there's no crime that's being reported, there's no element of assaultive or threatening behavior, there's no weapons involved, and the C.A.R.E.S team is available, then that call taker will send the call to our police dispatcher, who will review the call, and then forward that to our fire dispatcher, who will then send the call out and page the team for response. We will not stack these calls, so there won't be calls holding. If the resource isn't available, then it will go to a law enforcement resource.
Will the dispatchers receive additional training?
Correct. They have received additional training, more for the technology component of it, as far as sending it. But like I said, as far as taking the calls themselves, it's already included in their initial training, and they're very well versed in handling and de-escalating these calls. Like I said, the important part now is getting the right resource to these individuals that are asking for it.
What's the annual budget for this?
Well, that is a great question. Right now, we're at about, I think the council approved about $500,000 for this 2021 budget. And the reason I say it's a tough question, because it took us a while to get the people in place. So we've got a little salary savings here and there, and you know, we're starting in September. We're not really going to know what the needs are going to be for 2022. So the budget's going to be a bit of a target as we go on. We're not sure on overtime. We're not sure on a lot of different things as we move through phase one of this approach to CARES. But right now, it's right around $500,000.
There are other cities and other states that have a model like this. When you're putting together the plan for Madison, what do you learn from the other cities that have this in place so far? And maybe what are you kind of focusing on as you're saying, how are we going to make our own plan?
Sure, that's a great question. The question was, how do we compare with other cities, or how have we used what other cities have learned? One of the unique things about this program itself, and this really, you know, started as more of a mental health ambulance concept, and when our initial talk started. But one of the struggles I think every community has is it has to be community specific. And so although we had a lot of meetings and a lot of contact with the CAHOOTS folks in Eugene, Oregon, the C.A.R.E.S program in Denver, those are the two primary ones we did a lot of work with. There's things that they do in their program that we don't have a need for necessarily in Madison, and there's more needs in Madison that they don't address in those two programs. So as cities start these types of programs, and I think you'll see more and more of them come across the country, it really needs to be community specific. And that's why we brought so many partners in. Madison Dane County Public Health, Journey Mental Health, a lot of resources through Dane County Human Resources. Our partners in MPD really supplied a ton of data. Ellie Anderson with a data team had to tell us what it all meant. And so it's really, a lot of these teams are local issues. Unlike police and fire departments where, you know, models are set up, we know what police calls are, we know what fire calls are, we know what EMS calls are. They're pretty much standard across communities. This is a special niche market. Great question. Yeah.
Ideally, you know, you're getting thousands of calls a year, and you're only got the Monday through Friday going on with the van right now. It's just one van. So what is the ideal end game here? Are we talking, you know, a dozen vans in the fleets, or what is kind of the ceiling for a program like this? And ideally, if everything goes well, what is the time frame to which we can implement something like that?
Sure. The question is, what's the end goal, and kind of what's the time frame as we move on? I'll tell you this, and I'm actually going to ask a couple others to answer that question. I think Mayor Rhodes Conway can answer it. I'll give you my quick opinion. I think that it's such a niche market that eventually it's going to have to grow and expand into kind of its own entity. And so we would have a police department, a fire department, and a CARES team, right? We would like to expand it to 24 hours a day. Our partners in the county, I think, would like it to go county-wide. And so we'll see where it goes. But I'll let others share their vision on it as well. Mayor?
Thanks, Chief. It's a really good question, right? We are starting here based on the data that we know about the calls that we had pre-COVID. And I think that's really important, because I think if you just look at it, a lot of people would think, well, why weekdays, right? Why middle of the day? Why only the Central District? Those are all directly based on the pattern of calls that we already see. It's not that we don't have any calls in other times, but you look at the graphs and it's just 100% clear. That's where the spike in calls is. That's what we need to address. So, it's very important that we start where the most need is. I think ideally, eventually, what's going to happen is over this next year, we will learn, right? We'll learn from the call center data, we'll learn from the experience of the folks on the van, and we'll start to see how things are changing in our community. Hopefully this is addressing not only the volume of calls, but some of the underlying issues of people that perhaps are the result of, or the cause of repeat calls, so that we're actually reducing the volume of calls. But we're gonna have to look and see, as the data develop, where do we expand next? As the chief mentioned, I think it'd be great if we can expand this service geographically. I think it'd be great for Dane County if this could be a county-wide service eventually. Madison is certainly not the only place with these needs in our region. And I think ultimately it would be great to have some level of service 24 hours a day. What comes first and how long it takes us to get there, it really has to be driven by the data, right? So we're gonna keep a very close eye on what's happening and where the future needs are, and then we're gonna have to move to meet those needs as we know better what the situation is. But I'm very excited that today we're starting at the place that we know we have a high need, and that we're gonna be able to get this alternative resource out on the street.
Will the C.A.R.E.S program respond to any calls of the Beacon or the Salvation Army? How will you work with organizations that serve the homeless who often are who these calls are for?
So I'll let others answer in more specific terms, but obviously we don't discriminate on the basis of housing status in our services at the city. So yes, we'll be providing services to everybody, including folks that are currently experiencing homelessness. But I don't know if one of you want to take that?
Jump in on that.
Yeah.
And so we've been intentional to this point on a call. One of the debates we had as we were developing this concept early on is, do we have a hotline to call? And we decided to channel everything through the 911 center. So if there is a person at the Beacon that is in some sort of crisis and the 911 call comes in, absolutely, the C.A.R.E.S team will respond there if it fits the criteria, nonviolent and so, okay? And so, like the mayor said, like I've said, we don't know where it's going to expand to. Right now the intent though is to focus on that 911 user. And so there's no confusion about multiple numbers or different ways to get a hold of this team. It all channeled through the 911 center. Any other questions? No? All right. Well, I will say our experts will be available for a few minutes for one-on-one interviews if you would like. And thank you all for coming. Mayor, any closing statements?
Thanks, Chief. I just want to say thank you again, and I do want to point out, I think one name we haven't mentioned yet is R.L. Smith, who's here from Public Health. I'm sure we'll be happy to answer questions from the public health perspective as well. And I want to say thanks again. I know there's a lot of members of the team here. Thank you all for the work that you've done on this project. I'm really excited that we are able to launch this finally here in the city of Madison. Thanks for coming.
All right, thank you.